28% of sexual minority youths experience suicidal tendencies compared to 12% of heterosexual adolescents. These discrepancies are not new headlines, but public health research can help foster better mental health understanding in the development stage. I was given independence to explore a necessary talking point in mental health studies, minority groups. Therefore, the research project was depression in LGBTQ+ adolescents and the role of school connectedness. I will explain what I did throughout the internship, the outcomes of the project, why this research matters for the public, and lastly, what I gained from it. From undertaking a literature review, LGBTQ+ adolescents were underrepresented in current evidence based on social connectedness and mental health, despite having a higher risk of poor mental well-being. Within social connectedness, school connectedness was explored and can be understood as feeling supported, respected, accepted, and cared for by other pupils and teachers. To this, the mental health outcome I wanted to analyse was depression, due to the potential long-term impacts associated like suicidal tendencies. Therefore, the literature review led me to two key questions. Is there a relationship between school connectedness and LGBTQ+ adolescents? And is there an association between school connectedness, depression, and sexual minorities? The analysis used data previously collected by my supervisor, Lizzie Winstone. It was completed by over 2,000 Year 9 students in 20 schools across the southwest of England in autumn 2019. Key findings were that LGBTQ+ adolescents reported a higher average depression score compared to heterosexuals. Sexual minorities were closer to the at-risk category of 7 on the hospital anxiety and depression scale. For all adolescents in the sample, regardless of sexual identity, increased school connectedness was associated with lower reported depressive symptoms. However, the association between school connectedness and depressive symptoms was stronger for LGBTQ+ adolescents, where they reported a lower average school connectedness. So what does this mean for the public? My research brief highlighted implications that are in fact not new, but solidify the need for training of all school staff to emphasise inclusion, respect to all students, as well as fostering a safe space. Lastly, I wanted to reflect on the internship. As a geographer, I had the opportunity to talk with researchers from psychology to social science. It was proof that public health requires networks of all disciplines to provide a holistic comprehension to research, and through this create better mental health outcomes for all.